The project is a standalone children and adolescent hospital in terms of the specialized services. However, the facility will function in conjunction with the activities of Cornwall Regional main building, because there will be one or two shared services for greater efficiency. To date, I can report that Code Care is demonstrating, much to the pushback that we received in the early stages, that it can work and that it is bringing relief to hundreds of Jamaicans who are waiting, in some instances, 4 years and beyond, for a hernia or fibroid or some other form of ailment. We did not achieve and have not yet achieved the targets that we have set, but this is one of the reasons why I have signaled our intention to continue through to the next financial year, so that the extent to which we have these excesses, we can clean them up and have reasonable wait times. Now, wait is not unique to Jamaica. Everywhere in the world, people wait for public health services, even in the developed world, UK, Canada, US. But we understand the pain and suffering and the implications, and so we are managing this private-public arrangement, including the Code Care missions who have come into the country. I think 3 have come so far, and we're planning others, and the repair of our operating theatres which are taking place. Here in the West, in St. James, we have done, I'm told, 175 surgeries so far under the Code Care outsourcing method. Does this include the mission that came and did the 20 surgeries?
Yes,
okay.
yes.
So it also includes the mission that came. So 175, which includes outsourcing to private hospitals and also the missions that have come in. And this is just here in the Western Jamaica.
What we have done, we have looked at the waiting time of our patients here. And what I've realized is that the patients who are waiting for thyroid surgeries, we have had about 80 patients on the waiting list for over 3 years. And it's going to be difficult to catch up on those patients. So I'm proposing to start that process to get some of those operations done over the subsequent weeks. Or we run a renal dialysis service here. And over the years, we have had missions that comes to Jamaica that will do the fistula to allow for easy access to dialysis. And Dr. Hall informs me that he has 52 patients because of COVID. They were unable to have their fistula done. And he was asking me if this could be placed. And when I look at what is necessary for the dialysis to proceed, smoothly, I have requested that we should put these on the list as well to get these done under Code Care. So what we are doing is looking at the waiting list, see where the needs are, and then we'll make submission to the ministry from the clinical side to get permission. And the minister is fully in support of this program to move these patients, because once we have reestablished back into the hospital, we want to have a smooth running.
The 2 major construction in the Western region and here at Cornwall, Western Children's Hospital. I think we're comfortable up to this point that Western Children is moving apace. I'm told have completed 3 floors and 5 to go. So the 4th floor now is a work in progress, and it's an 8th floor facility. And if you take a look, you'll realize that the team, the contractors are working. We have the Urban Development Corporation, UDC, as project managers, quality control, and of course we work with the Regional Health Authority to ensure that that is taking place. The project involves, of course, Jamaicans and Chinese. I hear 47 Chinese are on site, 32 Jamaicans, and the government of Jamaica continues to support the project in a significant way. I think in between 2017 and 2023 we should spend about 500 million or 465 million, and that involves a number of things, the access to electricity, to water, that sort of thing, technical supervision, oversight, And we also have a commitment to spend between 500 and 700 million on other things, including equipment for the facility. The project is a standalone children and adolescent hospital in terms of the specialized services. However, the facility will function in conjunction with the activities of Cornwall Regional main building, because there will be one or two shared services for greater efficiency. So while the two are separate and are going to be focusing on different things, with Western being a specialist institution, it really would be inefficient not to create some overlap for greater efficiency. And that was envisioned with the project. So Cornwall, as it builds out, will see critical support to that facility. Ultimately, of course, it will add significant additional beds to the institution. So I can report that we're happy with the progress. Bear in mind, of course, the context of COVID, which had pushed back the project for 2 years. But since we have started, so far so good.